My name's Kristina Go. I am originally from outside Pittsburgh, Pennsylvania, and I did my training in University of Florida in Gainesville for general surgery and my fellowship in colorectal surgery at the Beth Israel Deaconess. I chose surgery because I really enjoy working with my hands, and in the OR I feel like I found the tribe of people that I want to work with day in and day out, but most importantly I feel like we can find immediate results for my patients, and that's probably what I find most rewarding about it. A lot of the patients that I see generally need evaluation for everything from a workup of colon cancer, patients who have been recently diagnosed or have been diagnosed with Crohn's disease and ulcerative colitis, and also some anorectal problems like hemorrhoids, maybe anal fissures, or having issues with abscesses and fistulas on their bottom. What I'd like patients and their referring physicians to know is that I'm always going to put that patient first. And the other thing is I think a lot of patients get really embarrassed about their problems, especially when you go into colon, rectal, or anorectal issues. I would want to reassure both the physician that's referring a patient to me and the patient themselves that I see these things all the time. They're not embarrassing to me, and I would try to make that patient feel as comfortable as possible. I think what is unique to what I bring to each patient I see is that I'm going to have a one-on-one relationship, and I want this to be more of a collaboration. I want to know what their problems are and try to tailor how we treat them as best as I can. I did have a challenging case recently where a patient was very sick from her long-term Crohn's disease and was just unable to eat or to keep up her nutrition. And she had a very long hospital course in and out of the hospital for several months. That year was very challenging for her and her partner. But at the end of this entire thing, they know me by my first name. We still keep in touch. I think that was probably the most rewarding thing, being able to address her problems and form a personal relationship with them.